Hello everyone, my name is Dr Schiariti. I am pleased to share with you the project report called Global COVID-19 Childhood Disability Data Coordination, a collaborative initiative of the International Alliance of Academies of Childhood Disability. The paper was recently published in the Journal of Pediatric Rehabilitation Medicine. The specific objectives of this project were to facilitate knowledge sharing about the impact of COVID-19 on disability globally based on survey data, and to identify key findings and gaps in knowledge based on content analysis of the surveys. The COVID-19 pandemic caused major disruptions in service provision, participation, and overall well-being of children and young people with disabilities and their families worldwide. As such, the International Alliance of Academies of Childhood Disability, known as IAACD, created a COVID-19 task force from June 2020 to December 2020 with the main goal of learning and understanding the impact of COVID-19. The task force consisted of 3 working groups. In this paper, we describe the outcomes of the surveys working group. You can access detailed information about the task force on the IAACD website. I have the pleasure to lead the surveys working group. This multicultural, international, and interdisciplinary group consisted of representatives of 7 academies of childhood disabilities as follows: the American Academy for Cerebral Palsy and Developmental Medicine, the European Academy of Childhood Disability, the Australasian Academy of Cerebral Palsy and Developmental Medicine, the Southern African Academy of Childhood Disability, the Latin American Academy of Child Development and Disability, the Eastern African Academy of Childhood Disability, and the Chinese Academy of Childhood Disability. We created the Global COVID-19 Childhood Disability Data Coordination Project. Specifically, we conducted a descriptive environmental scan of surveys. We created an online repository of surveys, updating the content of the web page as more surveys were completed or launched around the world. To summarize the findings of the surveys and identify gaps and overlaps, the content of the surveys was compared to the Convention on the Rights of the Child and the International Classification of Functioning, Disability and Health, the ICF. We identified 49 surveys involving information from more than 17,000 participants from around the world. Most surveys collected data representing the Americas, including North and South America, the European and Western Pacific regions. We identified surveys in more than 7 languages, and the majority were in English. We followed a multi-step methodology. Core themes addressed by the findings of the surveys were identified and grouped in categories shown here. The most frequently mentioned were health services, mental health, education, and support. Some examples of the theme group within these categories were disruption in health services, access to therapies, assessment, and evaluation. Within mental health includes declines in mental health and behavioral problems. In education, children's learning negatively impact, low quality of remote education, and disruption in special education. Within support, some examples were inaccessibility or insufficiency of specific food and essential supplies, and flexibility from employers and schools to ensure extended family to provide support. Another example was government support for people with disability was not available in all the regions. You can find more information on Table 2 in the paper. Key component of the project was reaching out to the global community. So we created frequent flash news identifying key findings of the surveys with a special focus on consistency in data collection, avoid duplication of efforts, gaps in terms of content and diverse perspectives, advocating for resources globally, and global preparedness for future COVID-19 waves with a specific focus on inclusive health emergency responses. Overall, surveys identify that COVID-19 has negatively impacted several areas of functioning, including mental health and human rights of people with disabilities and their families worldwide. Under the Convention on the Rights of the Child framework, several surveys collected information related to many human rights, including access to health, education, and social and economic health, which seem to be the more obviously affected areas during the COVID-19 crisis. However, there were some areas that were overlooked, including discrimination, recreation, respect for children's views, and access to child-friendly information related to COVID-19 and how to stay safe. On the other hand, by mapping the themes to the ICF components, it was identified that the pandemic has impacted functioning across the body functions and participation domains. Modifiable environmental barriers and facilitators were relevant in many surveys. Environmental factors have been a major focus of attention, perhaps because of the dramatic changes in people's life due to lockdown and social distancing. The surveys help identify a set of actions needed to remediate the impact of COVID-19. For example, need for accessible information and guidance for disabled people, flexibility from employers, information on accessing essential supplies, and flexibility in lockdown rules. Addressing these points would be important to inform policymakers in future waves of COVID-19 and future health emergencies. On a positive note, many surveys collected positive experiences during the pandemic, such as satisfaction with remote health services and remote educational programs. Children and families enjoy spending more quality time together. Parents appreciated their children's abilities as they spent more time together. Some children showed decreased levels of anxiety and behavioral problems, and the use of technology facilitated connections between families and healthcare professionals, providing positive support. In conclusion, the finding from this project report provides evidence that COVID-19 has negatively impacted several areas of functioning, overall well-being, and rights of people with disabilities and their families worldwide. Impact on mental health of people with disabilities, caregivers, and professionals continues to be a major issue. We strongly believe that global collaboration and rapid dissemination of information help mitigate the impact of the pandemic on the health of people with disabilities and their families. We invite you to read and share this project report. This is an open access paper and you can access it on the Journal of Pediatric Rehabilitation Medicine website. And thank you for your attention.